Hello and welcome to my channel. Today I will discuss with you people the diabetes mellitus, the most common and most important disease that has spread all around the world. So let's start. In this video, we will discuss some important points: introduction to the diabetes mellitus, mechanism of disease, its symptoms, types, and prevention. So let's get started. What is diabetes? Diabetes mellitus is a serious condition where the body can't maintain healthy levels of glucose in the blood. Glucose or blood sugar is the main source of energy for the body. So basically what happens is insulin is a vital hormone found in the pancreas, allowing the glucose to be transferred into the cells in the body, providing energy. In people with diabetes, insulin is no longer produced or not produced in sufficient amounts by the body. The body is resistant to insulin. Now, unhealthy levels of glucose in the blood can lead to both long and short-term health complications, and people with diabetes are at a higher risk of suffering from heart and kidney diseases and stroke also. So, talking about the symptoms of the diabetes mellitus, the patient will be having frequent urination, increased thirst, increased hunger, feeling of weakness in the body, and weight loss, blurred vision, nausea, and slow healing of bruises and cuts, and tingling sensations in the hand. Also, the patient will be having the history of diabetes mellitus in the family, and this patient is prone to infections, and there will be recurrent infections history of this patient. There are three main types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. And we will discuss them one by one. Now we will see some basic differences between type 1 and type 2 diabetes. Type 1 diabetes is insulin dependent, and in type 2 diabetes there is a insulin resistance. So in type 1 diabetes, the patient will be, as you can see in this picture, patient will be younger and lean, and no genetic predisposition evidence is present for type 1 diabetes. And type 1 diabetes is autoimmune. Insulin deficiency is present in this disease, so the patient will always be needing insulin. On the other hand, type 2 diabetes mellitus, which is insulin resistant type, so the patients will be mostly older and overweight. There is a history of genetic predisposition, and there is no evidence of autoimmunity. Insulin resistance in the cells is present and not enough insulin, not in most cases. Gestational diabetes. During pregnancy, some women develop higher than normal levels of glucose in their blood. This is gestational diabetes, and it usually develops in the third trimester after 28 weeks during the pregnancy. It usually disappears after the baby is born. So glucose screening should be done between 24 and 28 weeks. It can be controlled with diet and exercise, and medication is given if not controlled. Now comes the most important part, the prevention. How can we prevent this condition? If you are aged 45 or older, or in any of the risk categories such as being overweight or having a family history of type 2 diabetes or past diagnosis of gestational diabetes or polycystic ovarian syndrome in case of females, see your doctor for blood tests and be sure you go back to your doctor for any follow-up tests if indicated. Exercise regularly. 30 to 60 minutes of moderate physical activity or 15 to 30 minutes of vigorous aerobic activity can help you prevent this disease. Add resistance training to your exercise. Yoga, weightlifting, and other types of resistance training 2 to 3 times a week is also very helpful for the prevention of this disease. Avoid long periods of inactivity. Break up long periods of sitting with some stretching exercises, standing, or walking around every 30 minutes. Lose excess weight. Losing just 7% of your body weight can reduce your risk of diabetes. Avoid fad diets. Focus on finding a sustainable weight loss plan that works for you. Eat lots of fibers as they help you feel more fuller and eventually you eat less and gain less weight. Choose beverages wisely. Avoid fruit juices and sodas because all of these drinks are having refined sugars that can spike up your blood sugar levels and eventually you get diabetes. Thanks for watching this video. Hope this will have provided you a lot of information about diabetes. If this video has helped you and you like it, then press the like button, share and subscribe my channel. Thank you.